welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest reports from the world of medicine. New use of Botox injections may help reduce anxiety. Botox or botulinum toxin is a medication which is derived from a bacterial toxin and is commonly injected to ease wrinkles, migraines, muscle spasms, excessive sweating and even incontinence. Anxiety disorders are the most common class of psychiatric disorders according to a national comorbidity survey replication, a survey of the prevalence and correlates of mental disorders carried out between 2001 and 2003. According to the survey, 32% of the population are negatively affected by anxiety at some point at their lives, and treatments are considered ineffective, and nearly 1/3 of only of them are undergoing treatment. That's why clinicians and researchers seek other therapeutic options as well. The study published in the journal Scientific Reports found that people receiving Botox injections at 4 different sites, not just in the forehead, reported anxiety significantly less often than patients undergoing different treatments for the same conditions. More research is, however, needed to determine the mechanism by which Botox reduces the anxiety level. However, clinical trials will be necessary to work out the best site and dose to administer the medication specifically for anxiety. Prebiotic supplements help women reduce sugar intake by 4%. Probiotics occur naturally in some high-fiber foods but are sometimes added to foods. They are also available as dietary supplements. There isn't an official recommended guideline on how much to eat each day. Studies suggest that eating 3 to 5 grams of probiotics a day can benefit the health of our gut. In a recent paper in the journal Nutrients, the paper investigated whether prebiotic galacto-oligosaccharides can influence the food habits of 48 healthy young women between the age of 18 to 25. Their research concluded that it may be clear that probiotics such as galacto-oligosaccharides are effective in increasing the growth of gut bacteria, and this may have a positive impact on what we eat and how we even feel. Now, more research needs to be done to confirm and help understand the mechanisms that allow this particular probiotic to suppress our longing for sugary products. Oral arginine could enhance radiation therapy for cancer. Radiation therapy is a cancer treatment that uses high doses of radiation to kill the cancer cells and shrink the size of the tumors. Arginine, which is also called as L-arginine, is inexpensive and widely available, generally considered safe, and can be relatively easily obtained from the bloodstream into the brain. The idea of using it to treat cancer arose from observations that tumors often aid in their own survival by producing high levels of related molecular nitric oxide, and tumor cells often make more nitric oxide by upregulating their production of special enzymes called nitric oxide synthesis, which thereby synthesize nitric oxide from arginine. The study published in the Science Advances reported treatment with arginine, one of the most common amino acid building blocks of proteins, enhanced the effectiveness of radiation therapy in cancer patients with brain metastasis. The research concluded that in principle, any tumor that overexpresses the nitric oxide producing enzymes would be vulnerable to arginine treatment, and such tumors are considered very common. Further studies are, however, needed, and patients should consult their doctors about the use of any supplements outside of a clinical trial. High blood pressure treatment in pregnancy safe, prevents maternal heart risks. The latest American Heart Association statistics indicate hypertension during pregnancy, defined as a systolic pressure of 140 mmHg or even higher, is the second leading cause of maternal death worldwide. Severe cases are associated with increased risk of cardiovascular complications for mothers immediately or soon after their delivery and for years after pregnancy. Hypertension during the period of pregnancy increases the risk for complications to the offspring, such as preterm delivery, small for gestational age, and even low birth weight. Treatment for high blood pressure during the pregnancy period appears safe for many women and may even reduce the maternal risk for severe hypertension without increasing fetal and neonatal risks, as per a new study in the American Heart Association scientific statement that has been published in the association's journal called Hypertension. Future clinical trials are therefore needed to address questions about when to begin the treatment for high blood pressure during the pregnancy period. Also, close collaboration between American Heart Association and the American College of Obstetricians and Gynecologists will be instrumental in optimizing the diagnosis and treatment of hypertension during the pregnancy period and in improving immediate and long-term outcomes for many women who develop high blood pressure during this period. 8-week meditation program reduces blood pressure in chronic kidney disease patients. Vascular dysfunction and hypertension are common in chronic kidney disease patients and are associated with an increased risk of cardiovascular diseases. Mindfulness-based stress reduction is an 8-week meditation program that has been shown to reduce blood pressure in older patient populations. However, it was not known if it can lower the blood pressure in chronic kidney disease patients, and also the underlying mechanism was very unclear. Preliminary results from a recent study presented at the American Society of Nephrology indicate that the 8-week of mindfulness-based stress reduction may reduce the resting blood pressure in patients suffering with chronic kidney disease. Blood pressure lowering effects of mindfulness-based stress reduction therapy were regardless of changes in vascular endothelial function and even artificial stiffness. These are preliminary results for an ongoing clinical study that will include a larger sample size to extend these findings. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.